name is Dr. Birungi Mary. I'm a gynecologist, stroke obstetrician, as well as a laparoscopic surgeon. I work with the Emmanuel Medical Center in Entebbe. We've come back to talk more about the services that are offered at Emmanuel Medical Center. About the radiology department, we are able to do almost all types of x-rays. For the back, for the scalp, for the limbs, for the chest, we are able to do that, even for abdominal x-ray. On top of that, we are able to do HSG, which is hysterosalpingography. This type of test is done for mothers who have infertility because of blocked tubes. It can be done, it's not done under anesthesia, but it can be therapeutic as well as diagnostic. If you suspect that a mother is not becoming pregnant because of blocked tubes, you can do a hysterosalpingography, which can, if she is lucky and the blockage is not so severe, that one alone can unblock the tubes and the mother can be able to conceive. And if it's severe, it will still be diagnosed as blocked tube and then know the way forward for her. In our radiology department, we can also look for lost IUDs, intrauterine contraceptive device, because some people have a belief that when the doctor cannot see it through the cervix, they think it has gone to the rest of the body. No, it remains in the uterus. So with an X-ray or with a scan, you can be able to detect where it is and then be able to remove it. HSGs are always done around the 10th day of the period. Why we do them around that time is because we are sure that the mother is not pregnant, and what I've said that it can be therapeutic as well. You never know, if somebody has a mild blockage, it can open up the tube, the egg will be mature and fertilization can take place. How is the procedure done? The procedure is not done under anesthesia. Patients can be given painkillers like 30 minutes before the procedure. The woman should not be pregnant. She shouldn't have any signs of infection. And she should not be allergic to the dye that we are using. Though sometimes it's hard to know who is allergic and who is not, because maybe the mother is doing it for the first time. So, how is the procedure done? When we go to do the procedure, we put the mother in lithotomy position, like a mother who is giving birth, okay? We introduce a speculum in the vagina. We use the varicella to grip the cervix, and then a cannula to introduce the dye. But this is a sterile procedure. When we are doing this procedure, we also have to protect the patient. We give them protective gears, as well as the health worker is also putting on the protective gears. And I would like to encourage my patients or our mothers who are going for such procedure to always feel free to ask for the protective gears, just in case they have not been given, so that they are protected against radiations. The procedure can take like less than 10 minutes if everything is okay. It's done under cooperation. We encourage our mothers not to shift, because if a mother shifts and the radiations are directed away from the target, then we will not get proper results. And if we are not able to identify the problem at that stage, then we go for an advanced test, which is laparoscopy, diagnostic laparoscopy. But with that one, we don't have it yet here at Emmanuel. But we are on the way. We know we will require that one, so it can also be done here. Is this procedure painful or not? This procedure may be painful, may not be painful. It first of all starts with the preparation of the patient. If the patient is well prepared and she knows what to expect, then it may not be very painful for her. But we also give them painkillers, though not routinely, but we can give them painkillers like 15 minutes or 30 minutes before the procedure. And also, if the mother's tubes are not blocked, if they don't have severe damage, the dye will be able to flow through the uterus, through the tubes with less pain. Whereas if they are blocked, then that's where the pain comes from, because the health worker has to put some energy, some effort in pushing the dye to go through the tubes. What are the other services provided at Emmanuel Surgical Procedures? We have several surgical procedures provided at Emmanuel Medical Center with the help of the surgeons, whom we call on demand. And among them, we can do, if somebody has like intestinal obstruction, a hernia, an appendix, undescended tests, they can all be done here at Emmanuel Medical Center. And occasionally when we get orthopedic cases, these are the people who have broken their bones, we also call in the orthopedic surgeon, because the theater team is already there and they work on this patient from Emmanuel. Among the services we offer, surgical services we offer, we have both elective cases and emergency cases. Elective cases, these are the cases that are planned. You know that a mother has come in, maybe she has a fibroid, but within maybe a week or 2 months, I can be planned for a surgery, depending on, is the patient ready for the operation, is the patient fit for the operation, and also the financial implications to this patient. Sometimes it could be other social problems, okay? But when a patient comes in and they have made an appointment, they are booked in, then you make sure that you put whatever is needed in place. You have time, you are given time to put whatever you need for that type of surgery to take place in place, so that for the safety of the patient and all the other stakeholders in the operation. For emergency cases, these ones, they don't give you plan to plan for them. They don't give you time to plan for them, because they just come in like somebody is in their home. Maybe they have a ruptured ectopic pregnancy, that's an emergency. It can't wait for another day. It has to be attended to there and then. Whether the team is ready or not, you have to organize quickly and attend to that patient, okay? So these emergency cases, they are basically life-saving to the patients. That's why they are emergencies. They don't give you time. That's the difference between elective and emergency cases. About the more services available at Emmanuel Medical Center, we also offer family planning services to both the women and the men, okay? We have, for the men, we mainly have the condoms, which are provided free of charge. They take at will. They come at will and take them, okay? They don't even have to see a doctor about that. They can pick them. And we also offer the permanent method of family planning for men, that's vasectomy. Though the turn-up is not very, there are not very many who come for that service, but when it's needed, it's available. For the mothers, we have several family planning methods. We have the permanent, and then the long-acting but reversible one, and then these usual ones, the short-acting, like the pills, the Depo-Provera, we have them. And there are those ones who don't want any type of family planning apart from the natural method, based on their social or cultural belief, religious belief. We respect that, and those ones we teach them about the natural method of family planning. But here at Emmanuel, from the records I see, that we do more of IUD, intrauterine contraceptive device, and the implanon, okay? Intrauterine contraceptive device, we use the Colporrhaphy mainly because of the cost. The Mirena is quite expensive. We bring it in on demand, but when somebody wants it, they pay for it, and then they can get it. Me as Dr. Maria, I recommend all the different types of family planning, because I have to consider the client, what they have heard about, their knowledge about it. I have to consider their health status. Are they healthy enough to use that type of family planning? Is it okay for them? Will they achieve their goal in that? And is it readily available? So as the client comes in, I meet them at their point of need. But from experience, I see many of them taking up the long-acting reversible method of family planning, like the IUD and the implanon. Vasectomy, how safe is vasectomy as a family planning method to men? Vasectomy, it won't have any health effect on the man. The only challenge is this man will never be able to give birth again, okay? Even if some people can try to reverse, but chances of failure are very high. So that's why we want to give it to men who are ready not to have children anymore. Those ones who don't want to come back, that they want to make a woman pregnant again. And also we want them when they are very ready psychologically, because some of them, everything starts in the brain. If the man is not very ready for vasectomy and he talks about, maybe he discusses with his friends, they might give him negative information that can affect his sexual well-being as a man. These men, after they have done the vasectomy, we always do sperm count, okay? Semen analysis after 3 months, because the sperms take about 90 days to mature. So if there were some that were already in the process of maturity, okay, maybe they are hiding in the epididymis to mature, okay, that man can still make a woman pregnant within those 3 months, okay. But after that, when he's checked and there's no more sperms detected in the semen analysis, then that man can never pregnant a woman. After vasectomy, is there another way they can make a woman pregnant? Yes, there is. When we go for the ICSI, like we go to the fertility centers, they can aspirate the semen and inject it in the woman's egg. But that's another technology, not the natural way. That procedure of making a woman pregnant after vasectomy cannot be done here at Emmanuel Medical Center. However, if need arises and somebody feels they should, we can refer them to the appropriate centers where it can be done. I'm also going to talk about fertility as another service offered at Emmanuel Medical Center. On Friday afternoons, we run a fertility clinic, okay, for both the men and the women, okay, because fertility cuts across. Whether a man or a woman, the class, everyone can be affected by fertility. But when they come here at Emmanuel Medical Center, we take the history and investigations and try to find out where the problem could be. Is it the man? Is it the woman? Is it that both of them have issues, or is it unexplained? Then from there, when we identify the problem, it becomes easy for us to offer the service we can offer here, or if it's beyond us, we refer them to the appropriate centers so they can receive the service. Which tests do we do at Emmanuel Medical Center in connection with fertility? For the man, we can do semen analysis, but when we do that, we would want people to abstain from sex for about 2 to 3 days, okay? If you abstain like a week, many of the sperms will be dead, so you might get wrong results. Or if you've just had sex without that break, we can still get wrong results. So we encourage them to come to abstain 2 to 3 days before the semen analysis is done. For the women, we can do several tests, okay, depending on the history, because as we are all aware, like the fertility tests are expensive. That's why we want to take history examination so that we can select which tests are fit for this particular individual, so that we don't do everything, but we can do the thyroid, prolactin, the AMH. That one determines the amount, the eggs, the number of eggs the woman is remaining with, because as we know, eggs get depleted with age. We can do the reproductive hormone, follicle stimulating hormone, luteinizing hormone, estradiol. We can do all that at Emmanuel Medical Center. So after identifying the problem, then we can classify the couples and know that maybe this one, if I do this for her, she'll become pregnant. Or if I do this, or if I refer her, she'll become pregnant. After identifying the problem, like some women may not be conceiving because they have fibroids in the endometrial cavity where the baby is coming from. So if we find out like that, we can advise them to go for a myomectomy to remove those fibroids, and then the mother can conceive. If we find that the tubes are blocked, then that's when you can go for laparoscopy, diagnostic laparoscopy. We refer her appropriately. Or that's when we can do chromotubation to open up the tubes, okay? Sometimes you find that something is beyond your control. You've checked the couple, the man is well and the woman is also okay, then that's when you advise them to go for some intrauterine insemination. Then if we find that this woman is not able to have mature eggs, the eggs are not maturing, the cycles are not regular, then we give them medication to make the cycles regular so that she can conceive. What's the benefit of IUI to a woman who has fertility problems? So when we don't know, we've checked the man is okay, the woman is okay, the cavity is fine, the tubes are okay. For us to be able to, for somebody to qualify for IUI, the fallopian tubes have to be open, and the cavity, the endometrial cavity, should be clear of any masses. So, and the eggs should be ready. So when we do that and find the woman is okay, but you cannot explain why she's not conceiving, we do IUI to bypass the cervix, because sometimes the cervix can have antibodies or antibodies that kill up the sperms. That when the semen comes, it sticks there and the sperms fail to progress, to move into the uterine cavity, to reach the fallopian tubes and the fertilization. So the IUI is to bypass the cervix so that the sperms are introduced directly into the uterine cavity. So that's the benefit. And sometimes you find that maybe the husband has issues with the impotence, okay? So he may not be able to introduce the sperms right into the vaginal cavity. So IUI can help in that area. And it's not as expensive as the IVF. Yes.